Hi guys, Dr. Martina here, and in this video I'm going to give you the gritty truth about the difference between composite bonding and porcelain veneers. Now, I get a lot of people asking me for composite bonding and veneers, and really they are the end result, which comes after a process of really discussing through with that patient what it is they don't like about their smile and what they want to achieve. And when you come through that process with speaking to your dentist, a good dentist is going to lead you down that path and discuss the different options with you and really come up with a treatment plan that's going to be best for you. So when you go to your dentist, go with the problem that you have, go with the issues that are really concerning you, and that way you're going to come out with the best treatment plan that's going to work for you. So there is a big difference between composite bonding and veneers, and I think there's a lot of misinformation out there. Composite bonding is a fairly minimally invasive procedure, but let's not make any mistake, it is a procedure to your teeth and it is not completely reversible. Often when you have composite bonding, you might need a little bit of enamel preparation done to the teeth, and over time that composite bonding is going to need replacing. So it's not going to last you forever, it is going to chip and stain, and you need to be aware of that when you're looking at composite bonding versus porcelain veneers. Composite bonding is a resin-like material that the dentist applies to the teeth. We usually tend to hand sculpt it and we bond it to the enamel, and then we blend it in and shape it to the perfect shape and size for you. Composite bonding can be used for a variety of different needs. We can use it to close small spaces, we can use it to reshape teeth and improve the size and shape of teeth, as well as repair tooth wear and chips on teeth as well. So composite bonding lasts between about 3 and 7 years, and it is very, very technique sensitive procedure. So not all composite bonding is the same, and when you're shopping around looking at different prices of composite bonding, you need to take into consideration the skill and experience of the dentist as well. It can take years and years to really master the skills that it takes to create beautiful composite bonding, and if you shop on price, that's all well and good, but make sure that you know you're getting what you pay for. Composite bonding prices can really range from dentist to dentist, again depending on their skill and experience. Prices range from around about £195 per tooth all the way up to about £500 per tooth. At the Dental Architect, we have 2 levels of composite bonding. We have our associate dentist level, which is £195 per tooth, and the cosmetic dentist level, which is £275 per tooth. So porcelain veneers can do the same job as composite bonding. It's like a false fingernail made out of porcelain that we bond to your tooth. Most times we do need to do quite a bit of enamel preparation on the front of the tooth. It can only be a small amount in some cases, but in other cases we might need to do quite a large amount of enamel reduction depending on the straightness of the teeth. Porcelain veneers you would expect to last about 10 years. They're much less likely to chip and stain as they tend to keep their glaze. The kind of price range you're looking at porcelain veneers again can vary, and it really depends on the quality of the lab that the dentist is using, and again the skill and experience and the materials that that dentist is using. Prices can vary from around about £400 all the way up to £1,000. The prices here at the Dental Architect are £480 per porcelain veneer. So when you're weighing up the pros and cons of composite bonding versus porcelain veneers, really have a think about what it is you're looking to achieve. Have a think about your budget and also the skill and experience of the dentist that you're going to go to for your work. A good dentist will sit you down and talk you through all your available options. So there may be a lot of other options to consider instead of composite bonding and veneers. For example, do you want to look at straightening your teeth with things like braces or Invisalign, or would whitening suffice? If you've got really good quality teeth, good shape, good size, and the enamel's really beautiful, then why would you want to drill them all down and place veneers on your teeth just to straighten them when there's other way less invasive options out there? Composite bonding and veneers are great when your teeth are already aligned because we can use it as a way to improve the shape, size and colour of your teeth. However, if you've already got really crooked teeth or your teeth really stick out, then they're not going to be a great option for you, because remember, it's an additive procedure, so it's only going to make the teeth look bigger or more goofy. And if you've got really crowded teeth, just think about how much tooth structure we would actually have to cut down to make your teeth look straight with bonding or veneers. So often it is a case that we may need to do some pre-alignment first with Invisalign, and your dentist will be able to talk to you about that option as well. So I hope that's given you a good overview of the differences between composite bonding and porcelain veneers. And stay tuned for our next video, which is a very contentious issue about the difference between staying in the UK for your cosmetic dental treatment and going abroad.